The topic for the video is elemental impurities limit calculation as per ICH Q3D guideline. There are different type of impurities in the drug substances and in the drug products. The elemental impurities are also called as organic impurities, and these elemental impurities may come from the synthesis of drug substance, may come from the excipients, may come from the container enclosures. So whatever the components are there, whatever the raw materials are there, these may be containing the elemental impurities. The reagents, catalysts used during the drug substance synthesis can contaminate and come into the product as elemental impurity. There are different type of elemental impurities, and in this video we are going to learn regarding the specification and the limit calculation. There are mainly four options for the elemental impurity calculation and the limits. Option 1, option 2A, option 2B and option 3. The option 1 is used when the dose of the drug product is less than or equal to 10 grams per day. Option 2A is used when it is required to be adjusted for the high dose products. Option 2B, it is a component based control. Option 3 is a direct product testing. So option 3 you can say as a product testing, and whatever the limits are there, these limits should not cross in the drug product. So testing is required in the option 3, while based on the risk assessment you can justify the drug product is passing the limits as per option 1, 2A and 2B. Now we will see these options in detail. Elemental impurities limit calculations are done as per the ICH Q3D guideline. So how PDEs are converted into the limits for APIs, excipients and products, that we will learn. ICH Q3D guideline defines the permitted daily exposures for the elemental impurities. PDE stands for permitted daily exposures. For calculation options, there are the criteria based on the daily dose size, known impurity source, whether testing API, excipient or final product. Option 1, fixed daily intake. It is equal to or less than 10 gram. Use case, total daily dose is less than or equal to 10 gram. So as per the guideline, we have the PDE for each element. For example, cadmium, we have the PDE of 5 microgram per day. So if you want to set the limit for cadmium, formula is given as per the option 1, that is fixed daily intake of less than 10 gram or equal to 10 gram. So you can see in the formula, PD is divided by the 10. PD is in microgram per day and the daily dose is in gram per day. So the limit will come in microgram per gram. If cadmium is considered as an example, 5 microgram per day is the PD divided by 10, it will be 0.5 microgram per gram. This is option 1. Now option 2A. So the daily dose is about 10 gram. That time the option 2A is used. So here limit microgram per gram, PD divided by the actual daily dose, that is gram per day. Pulver, PD is 5 microgram per day, daily dose is 25 gram. per day, that is about 10 grams. So limit will become 0.2 microgram per gram. Then option 2B, it is component specific limits. Use case, impurities linked to API or excipients. Formula is shown here as the summation of the excipients impurities. Example, API excipients, the total is done based on the microgram per gram, and the total should be less than the PDE value. So simply it means that all the components whatever you are going to use in the product and their PDE is calculated, and the total of all the impurities or total of the impurity should be less than PDE value. Then you can say that the product is meeting the requirements. Now coming to the option 3. So it is the analysis of the drug product. If the product is not meeting option 1, 2A, 2B, then we need to do the finished product analysis. It is direct measurement of the impurity in the drug product by testing. So measured total impurity or elemental impurity in microgram per gram, microgram per day, it should be less than PD. For example, 5 gram is the product and 0.2 per gram is the impurity. So 5 into 0.2 will become 1 microgram per day, and PD for arsenic it is 15 microgram per day. So it is passing the limits. Now see the summary table for options. Option 1, 2A, 2B and 3. So option 1 is used when the dose is total daily dose is less than or equal to 10 gram. 2B, it is used when the total daily dose is higher than 10 gram. 2B, it is component specific, and option 3, it is the finished product testing. As per my experience and understanding, generally the dose of the drug product by oral route is not more than 10 gram. So generally the dose may be up to 3 gram or 5 gram, considering the 1000 mg dose, and it is administered 2 times a day. So the tablet weight is considered, and generally I found for many of the formulations the dose is less than 10 gram. For some of the formulations in which the higher dose is there and the strength is less, for example, the total daily dose of the API is let's say 2000 mg, and the tablet is there and it is 200 mg per day, 200 mg per tablet. So if you calculate, and if the tablet weight is more, let's say it is 700 mg or 500 mg, so many of the times uh, it goes beyond certain range of 10 gram. And also sometimes some of the components containing the elemental impurities like talc, magnesium stearate or lactose or starch may be present in the higher amount, and it may be possible because of these excipients we are crossing the option 1, 2A, 2B. So we come into the option 3, but still there are very less chances in the elemental analysis or elemental impurity analysis that the drug product will fail. So many of the products are filed on the basis of the risk assessment. So this is the information. I have made some other videos also on the PDE calculation, on the elemental impurity limits and basics. So I request you to go through those videos. So once again quickly we'll see the options so that you will remember. Option 1, 2A, 2B, 3. Option 1 is when the standard dose is less than 10 gram or it is equal to the 10 gram. Option 2A, adjusted for high dose products. Option 2B, component based control. Option 3 is direct product testing. So together These approaches ensure the patient safety and the regulatory compliance. As like other impurities, elemental impurities are generally not tested in the product, and based on the risk assessment, the product is filed. Thank you for watching the video. Let's meet soon with another informative video soon.